Am I audible? Is my screen visible? Please mention in the chat box. So today's topic is kitchen management. This is the last chapter, I guess, in your infection control management textbook. Those who have the textbook, you can mention the page number in the chat box for others to see. If anyone is joining late, please help them out with the topic name or the page number. So dietary and kitchen services, what infection control strategies you have to follow here in kitchen services, okay, in a hospital. So there should be a quality control officer or an infection control officer or a food supervisor, any three of them. Okay, they should be conducting daily inspections in the kitchen. Okay, when it comes to a hospital, daily inspections are a must. Okay, either 2 times or once a day, daily inspections are a must. Okay, because kitchens are identified as a places that could lead to outbreak of any foodborne diseases. And foodborne diseases is a common source outbreak. Common source outbreak means with one source, it has reached to various patients or people at the same time. Okay, so it can create a havoc like situation in a hospital. So since it's a high risk area, and because of this reason, kitchen and the dietary department are considered as high risk areas in a hospital. Okay, so staff health and hygiene should be monitored on a daily basis. Who all are the kitchen staff, their health and hygiene, and also you should have the records of their health monitoring test, health checkup, hygiene practices, keep a record of it. Pre-employment checkup has to be done for anyone who is going to be employed for the kitchen. Okay, because anyone could be a carrier for certain diseases like typhoid. Okay, you have typhoid carriers, certain parasite carriers like hookworm, tapeworm. Okay, people can be carriers for these infections. Stool examination is the ideal one to be done. Past medical history can should be collected. So before employing somebody for the kitchen or the dietary department, pre-employment health checkup is a must and keep the record of it. Then food handlers who have infectious disease, like while working, they got some flu or something like that. Any communicable disease, if they contract any communicable disease while on work, they should immediately stop working, okay, until they recover completely. And they can only join back to work after they have a medical certificate. Okay, they have to certify their fitness to re-enter the work, okay, after their medical leave. And routine medical checkup has to be done twice a year. Even though you have done pre-employment health checkup for all your staff, routine medical checkup has to be done twice a year. And you have to document all these reports, whatever we have discussed so far. All reports in personal file has to be maintained. Every staff should have their personal file. So in the kitchen, cleaning procedures should be on a regular basis. Okay, that is wet mopping should be done on a regular basis. All the horizontal areas should be cleaned at least twice a day. Vertical surfaces should be cleaned at least once a week. Okay, so this is the regular practice you have to maintain. Food storage area should be cleaned and kept uncluttered. Okay, everything has a place and everything should be kept in that place. That is the motto of housekeeping services that has to be followed in the kitchen department as well. Every single thing has a place and everything should be kept in that place. Okay, so it leads to uncluttered work area. Food capable of microbial growth should be stored below 8 degrees Celsius or above 65 degrees Celsius. Okay, either it should be refrigerated or it could be kept in Brain Mary kind of a storage. Okay, Brain Mary bins that can be used for storage. Food capable of microbial growth, usually it's all food that have more moisture in them. Okay, not the non-perishables, perishables. Okay, that have a lot of moisture. Okay, they are capable for microbial growth. Milk, cooked items, fruits, vegetables. Okay, naturally they have a lot of moisture. Any food that has a lot of water content or moisture, okay, they are prone to uh, get stale quickly. Okay, cooked and chilled food should be kept below 3 degrees Celsius. Cleaning schedule must be followed. Okay, you will have a rotational duty roster for housekeeping people who are in charge of cleaning the kitchen. Okay, that schedule has to be followed based on the parameters of your healthcare system. And should be prepared half an hour before service, stored in bain-marie at 75 degrees Celsius to 100 degrees Celsius. So when you are serving the food to the inpatients or even to the visitors, okay, or anyone whoever is a customer to your dietary department, it should be hot, okay? It should not be cold, stale food. So prepare the food half an hour before servicing when it comes to inpatient, okay, before it reaches the inpatient wards. And trolleys that you use for transporting the food should be cleaned regularly, and do not use these trolleys for any other purpose apart from delivering food. Storage, dry ingredients should be cleaned before storing in plastic bins. That's the pulses and cereals and all. They pick up the stones and all before storing it. Green leafy vegetables or other vegetables should be always kept in refrigerator. Okay, and just before using it for cooking, you have to wash it. Don't wash the vegetables together and then keep in the refrigerators because it will get spoiled. Milk should be purchased on a daily basis, stored at 8 degrees Celsius at least. Potatoes, onions, roots, tubers, they all should be stored in plastic trays. It should not be container, it should be plastic trays because open air should be there. Okay, if you keep it in closed container, the humidity and moisture will lead to sprouting of potatoes and onions. Okay, so to avoid that, open plastic containers can be used to store potatoes, onions, roots, tubers. And every vegetable shopping should be done at an interval of 3 days. Okay. Coming to the waste disposal, color-coded containers can be used in the kitchen department as well. It's usually green and blue. Okay. And if there is any cuts, bruises, or any accidents in the kitchen department when first aid is used, okay, all the human body blood or fluid stained dressings should be thrown in yellow containers. Okay, apart from that, any infectious things should be thrown in yellow containers. Apart from that, compostable ones should be in green. Plastic should be in blue. Okay, recyclable plastic should be in blue. Everything that can biodegrade or used as compost should be thrown in green containers. Leftovers should be sent to disposal through municipal authorities. They can use it for composting purpose. This is a checklist. If anyone wants this checklist, you can WhatsApp me and my number. I will forward you the checklist. I have mentioned the WhatsApp number in the chat box. If anyone wants this checklist, WhatsApp me. I will send you the PDF file of this. Okay, so this checklist you can use as it is for your kitchen infection control. Okay, or you can make your own changes as per the policies of your hospitals, add new statements here or remove some statements. Okay, but in general, this is the standard infection control checklist which can be used in a kitchen or dietary department. Okay, so first part is regarding the personnel, your staff. Okay, their clothes should be neat, clean, appropriate. Shoes, they should wear shoes with closed heels. Okay, or have a socks. Hair net or hair caps has to be worn. Okay, apron, if it is soiled, change immediately. Okay, jewelry except for wristwatch or wedding band or earring, nothing, no other rings or anything should be used. Artificial jewelry should not be used, and nail polishes and all should not be used. Okay, during hand washing, all jewelry has to be removed and then worn again. Good personal hygiene has to be maintained. That is, they are not supposed to have long fingernails. It has to be short. Strict hand washing procedures has to be followed between, before, and after handling the food. Okay. Without hand washing, do not do not touch the containers of the food. And food is handled in such a way that it should not spill or be falling on the food handler's clothing. Do not have habits like chewing gums, using toothpicks inside the kitchen department, smoking, okay, using any no snuff, etc. It's not permitted. If the staff wants to eat or drink something, their lunch break and all should be outside the preparation area, food preparation area. Any infections should be reported immediately and action has to be taken. Health records should be monitored. On hiring also, health screening has to be done. Infection control program teachings has to be given to the employees as per their capacity of knowledge. Next part is the food preparation and serving part. Okay. So utensils should be clean. 2-spoon method has to be used for taste testing. That is, you pick up the food with 1 spoon, place it on another spoon, okay, and then taste the food. That is a 2-spoon method. Then food temperature should be maintained for storage. We don't want to get it stale. Expired products like masalas and all, or some sauces, okay, these has to be discarded immediately. Food served is covered, okay, during transport so that no impurities will reach the food. Leftovers are discarded within 48 hours. Otherwise, it will smell bad, okay? It will create bad odor. So dishwasher temperature, you can read all these statements, okay? Cleaning schedule should be followed for every equipments. Waste should be stored and disposed based on the color codings you used in the hospital. Any equipments that have crack or they are broken, okay, should be discarded, okay. All equipment filters are cleaned on a weekly basis. Light bulbs are covered properly. Hand washing facilities should not be used for any other purpose. Only hand washing has to be done there. Don't wash any utensils there. Soap, warm water and drying method. These three things should be present wherever hand washing is done. Cutting boards and meat slicers, etc. They have to be washed on a daily basis. Okay. So that's about kitchen checklist. In detail, whatever is there, you can